Well, hello. Sorry I'm a little late getting this video done on codependency for you, but let's just call this codependency part 1. You're deep enough into the Terry Kellogg book now that I'm sure you're totally confused, somewhat confused, or think you understand it and don't even know you're confused, or you're one of my brightest students and you know more than everybody else. For 20-something years now, the American Medical Association and the insurance companies have debated as to whether codependency is a disease that should be classified as such and then placed in the Diagnostic and Statistical Manual for Psychiatry and Psychology, and therefore making it eligible for insurance reimbursement. Insurance companies have fought it because they realize they would probably go broke because of how many codependents there are in this country. It might be our #1 disease, and certainly it's our #1 unrecognized disease. It is a disease because it has a beginning, it has a middle, and it has an end, and often that end is jails, institutions, death, or terminal or long-going illness. The thing you and I have to watch out for is that the people in the serving professions, social workers, ministers, educators, nurses, as an example, are attracted to the service jobs because of their codependency. Not saying that all these people in these professions are codependents. I'm just saying there probably are more codependents in these professions than any other. Pretty safe bet on that. So we confuse our need to help others with, well, let's find out what it is who we're really trying to help here in a second. At a group therapy session for codependents in my counseling practice 20 years ago, I guess it was, and a woman, we'll call her Ursula, hadn't said anything for 3 weeks, and finally on the 4th week she rather exploded and said that she was very mad because it's not right that somebody who loves people is seen as having a sickness. So I said, well, there you go right there, because it's not about you loving other people. It's about you loving yourself, or calling it that, if you're honest, and at a deeper level, needing other people in order to feel fulfilled. An old kind of tongue-in-cheek definition was that when a codependent drowns, somebody else's life flashes in front of their face. More truth and poetry in that. Codependents are, again, some common definitions: live through other people. They need other people in a rather extreme way. Ernie Larson, one of the great writers on alcoholism and codependence, once said that if you believe that other people hold your sunshine, and we need sunshine to live, but you don't see yourself as a source of sunshine but located in others, you will have to do anything you can to control those sources of sunshine so that you can survive. So there's certain desperation involved. Originally, codependency came out of the alcoholics who went away for treatment, left the spouses at home, looking for something to do. They started Al-Anon, just kidding. But truly, they did start Al-Anon, which eventually became known as Co-alcoholics, evolved over time into codependence because people were hooked on other things other than alcohol, had the same personas. So they actually discovered that that codependents look for people to rescue, people to live through, people they can dominate through their illness. And so who is sicker in the relationship? Some people wonder. It's a very serious business, codependency. Again, it has some rather dreadful consequences. I'll talk in a little bit about psychologically where this comes from, but for now, I hope you see where some of the common misconceptions are, and also maybe you're getting a grip on what it really is.